Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. A trip overseas led to a chain of medical events for Amy Wallace. A rare diagnosis led to an organ transplant. But Amy is living proof that everything is possible with the gift of life. Mother of two, Amy Wallace has had her fair share of health issues. They started back in college.
I was diagnosed with ulcerative colitis, a bowel disease. You just kind of lose control of your bowels a little bit, and so I was trying to get remission where my day-to-day was manageable and I could work, finish college. So lots of medications, lots of doctor visits, lots of missed school and missed opportunities.
Then at just 24, she was diagnosed with PSC, primary sclerosing cholangitis. It's a rare liver disease where the bile ducts become inflamed and scarred, causing bile backup and long-term damage over time.
At the time, they said this is a disease that's incurable without a liver transplant, and typically most patients need one within 8 to 10 years to survive. So I'm doing the math, and I'm 24. I haven't had the ostomy surgery yet, and so now I'm like, I have two things against me in this life right now. I don't know if I'm gonna make it, what's gonna happen?
She lived life throughout her 20s and early 30s, knowing that a liver transplant was inevitable.
6 months to a year, things got a little bit worse with my liver. And so by probably 3 years to 4 years after being told that big news, I knew I was sick. And foods I ate would affect me. The bile doesn't run through your liver as quickly, and so it gets stuck in your bloodstream. You get really itchy. I turned very jaundiced. I was very fatigued, very tired. My liver just wasn't operating as it should. So it was very evident that time I was sick.
As her symptoms progressed, her hepatologist at the University of Kansas Health System, Dr. Ryan Taylor, put Amy on the transplant waiting list. Amy was on that list for a year and a half.
Tears were shed, but I knew it's gonna be okay.
She was in and out of the hospital on medications, antibiotics, trying to keep infections at bay, until she got the call during one of those hospital stays.
They actually were talking about sending me home for the weekend. And I really, really begged and pleaded, can I please just stay here? I really need this transplant and I don't wanna go home. Can I just stay? And wouldn't you know, by Thursday night or Friday morning, I can't recall, my labs were worse again and I got the call. So within 2 days, basically of being in the top spot, I got the call, still in the hospital. So it was a whirlwind after that.
Now, 8 years post-transplant, Amy and her family are living every moment to the fullest. She hopes to one day thank the family of the donor who shared the ultimate gift.
My life has changed so much in nearly 8 years since that happened, so it would be quite the story if I could ever share that gratitude.
We are so glad to welcome Amy to our program, as well as Dr. Ryan Taylor, transplant hepatologist and director of the liver transplant program. And we've got right here next to me Dr. Tim Schmidt, director of transplantation and transplant surgeon here at the University of Kansas Health System. Dr. Schmidt, you haven't seen Amy in
not in a while, no.
Quite a while, right?
Yeah.
She looks good.
Looking good, huh?
Couldn't tell she had a transplant.
Can't tell she had a transplant because, again, you do so many transplants, and once you do a transplant, you're kind of off to the next, and she gets on with her life.
Yeah, which is awesome because that's what we try to do this for, so people can have a normal life, and then seeing their kids there is great because that means things are going well.
Yeah, and that's why you do what you do. Amy, how are you feeling today?
I feel blessed beyond measure. Thanksgiving is this week. It's kind of due time, to count your blessings in life. And 8 years from transplant, 15 from ostomy surgery, and I'm very, very healthy today. And so I couldn't be more happy where I'm at.
You said you're hosting, so you feel up to it. You feel lots of energy.
Thanksgiving. I got energy. I'll make the turkey. Yeah.
Right. So something you wouldn't have been able to do 10 years ago.
Absolutely not.
Absolutely not. So you were in college at the time that all of this really started when you first got sick. How did that diagnosis shape your life back then?
It was very shocking. I was very uncertain of what that meant with the diagnosis of ulcerative colitis at the time. And little did I know it would lead to everything I've gone through. So I was going into my senior year of college. I just wanted to finish college. I was there, 4 years. I just wanted to be a elementary school teacher. I was doing my student teaching coming up, and I was slowly just dealing with ulcerative colitis and losing control of my body. And that was really hard at 20, 21 years old to go through and kind of understand the impact of that.
So kind of give us a timeline. How many years were you managing your illnesses? Because there were several.
There were several. That one was about 3.5 years, but my body just got so sick so fast. So definitely tried medications, treatments, things like that, but ultimately had to have an ostomy surgery with the removal of my large intestine. So I'll live the rest of my life with an ostomy, and it's been one of the best things that happened to me, truly. But that led to the secondary diagnosis of PSC.
So Dr. Taylor, for patients with PSC, what are the early warning signs, and what makes this so challenging to manage?
It's a really difficult disease because many times there aren't any warning signs. You may just get labs that are abnormal when you get your routine physical at your doctor's office. But once you start to become symptomatic, you can become jaundice and have itching. Those are some of the earliest signs. And then, the problem with PSC is it just manifests differently in every patient. Some patients have itching, some patients get infections, some patients can get bile duct cancer, and it can be very different depending on the patient situation.
So who's susceptible to PSC? Kind of explain a little bit more about it. Where does this come from?
It's an autoimmune disease, but interestingly, it's clustered and related to patients who have inflammatory bowel disease. So we see a high percentage of patients with ulcerative colitis or Crohn's disease who actually get PSC.
Which is what Amy had.
Yes.
Okay. Dr. Schmidt, we recently launched our living liver donor program. Amy had a deceased liver, we know, when she had her transplant. But how will living liver donor programs, like the one that we just recently launched, benefit patients?
Yeah, people with PSC are kind of disadvantaged from the MELD score because their score doesn't go up as bad as they feel, and so they usually don't get a highest score as some people. There's now exception points, but their MELD scores are typically lower, so living donor kind of fits in that area where people have kind of a purgatory, so to speak. They can't get high enough and they still feel really bad. So
explain the MELD score, though, for people who might not understand that.
Calculation to determine how sick a patient is with liver disease based on labs, and people with PSC don't get as high as scores as other people with other liver diseases, so it's really a disadvantage for them.
So they don't get put on the list?
They're on the list.
They're on the list.
They're just not high enough on the list to get a deceased donor transplant oftentimes now.
So it sends them looking for their own?
Or they have to wait a longer period of time to get really sick, and with PSC that takes quite a while.
So, Dr. Taylor, regardless of whether it's a deceased or a living donor transplant, what does the process of getting on and staying on the transplant list look like for a patient?
It's a big process. I like to call it an astronaut physical, where you go from head to toe. We look at you, we do all your major organ systems that get checked out. You see about 10 different consultants. We just want to make sure your body can handle going through a transplant, which is one of the biggest operations and processes you can ever go through. So we make sure your mental health is stable. We make sure you have a strong heart, make sure there's no other infections, things like that. So it's a very thorough process. Usually takes about 2 to 3 days of testing to figure that out.
Abby, you remember going through all of this? Tell us about what you remember.
Well, honestly, with Dr. Taylor, my son, who's now 13, was 3. When I went to the appointment here at the hospital, he was sitting on my lap, just him and I, and that's when I got the first news from Dr. Taylor that he really suggested I get put on the list. It was a little hard to hear. I'm a young mom, and I didn't know really, I knew that was a good thing, but it felt very daunting of like, now I'm at that point.
And what's it like when you have somebody in their young 20s going on the list and you're having to have those conversations with them? I mean,
well, when you're that age, you're supposed to feel really indestructible. I mean, it's a hard age to feel sick, and being a patient is tough because you have to give up control and allow things to happen to you. And when you are young, a mom, just got out of college, you don't want to deal with things like this. So I imagine mentally it was more challenging than even physically.
Yeah, yeah.
I would agree, yeah.
And you just moved too, right, if I recall?
Yes, yep, we just moved back here to Kansas. Yeah, there's a lot of things going on, but to that note, one of the best things was getting established here at the medical center under your care, Dr. Taylor.
Well, thank you.
That really made a difference.
Yeah, I bet. So Dr. Taylor, Amy, she was young when she developed PSC. Is that pretty typical to see somebody at a young age?
That's a disease that kind of has clusters at younger age and older age. So we have a lot of patients, young patients in their teens and 20s, just trying to be normal people and have to deal with these very difficult problems. Because not only do you have the liver many times, but you also have the bowel problems, which can be equally challenging.
Does that change a treatment approach, just being younger? versus the older cluster? Is
Not
it
so
pretty much
much.
the same?
In some ways, the younger patients are a little bit easier, just in the sense they don't have other diseases like heart disease, diabetes, other things that people get as they get older. So it makes it a little bit more straightforward. But then also, younger people are trying to have jobs, go through school, and just trying to live life, and that just makes it especially challenging to have all these medical appointments, be hospitalized, have this unpredictability with how their health is.
So what kind of lifelong care and follow-up does Amy need as a transplant recipient?
She's doing really well right now. We're just commenting that it's been a while since I've seen her, because once patients get their transplant and get on autopilot, as we say, we really see them about once a year. So they get labs every 3 months and a check-in with us and do their routine health with their primary care doctor, and that's about it. So usually a few years after transplant, the only different thing is they have a scar and they take usually 1 or 2 medications for the rest of their life. That's really about it.
What has it been like? What has it been like post-transplant for you?
Like he said, I have many scars and I take some medications, but I live life to its fullest, and I do anything really that my heart desires now, and nothing's holding me back like it used to, waiting on that transplant.
Are you teaching?
So I'm in the education realm with healthcare.
Yes, and that's something that we're going to
Yes.
talk about, because that's really exciting. That's going to be kind of like an interesting full circle moment for you. I want to talk about that night though, because that you kind of knew to stay. That story you told me when we first met about how you kind of knew you wanted to stay because you really wanted that transplant. You kind of knew your body, and you're like, please don't send me home.
Yes.
Tell me a little bit about that.
Sure. So at that time, I was a preschool teacher, and my son was 3, going on 4, and I got a call on Monday. My labs didn't look good. I need to come in for some routine. Let's keep you healthy enough to keep going. But of course, at that point, you get exhausted, and I kind of felt like I just need to replace this. I'm kind of exhausted from trying to keep this one going. Needless to say, Monday turned into transplant that week. By middle of the week, by Wednesday, my labs were high enough, meaning I was sick enough to be first in line, as you could say. I explained to my toddler at the time that I was now the line leader, because they do that at preschool. Yeah. And so he understood the line leader in his vocabulary. It meant you lead and you're first. And so I just said, I'm there, I'm first, I just gotta wait my turn now, and within like 2 days. And so knowing all that while I was in the hospital, they thought you could go home over the weekend, we could call you. And I was determined enough to say, I really don't wanna leave. I wanna stay here. I think it's coming. I wanna stay put if I can. And I was able to, and I got the call.
And that's what you mean, Dr. Schmidt, by that MELD score, that tricky place that you're just kind of hovering, and just like, you don't want to get too well, but you can't get too sick.
Right.
Because you got to be healthy enough
if you're sick, you feel bad, but you also have to get that way to get the score high enough.
So you can't, is it tricky, like you can't get too sick because you have to be able to withstand having the transplant, correct?
Right, and that's the balance. I mean, younger people tend to be less, they don't have frailty problems. Older people tend to get more frail as they get sicker, so that's even a more challenge when they're older patients.
Sure. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook, or you can email the Medical News Network. That information is there on your screen. Well, again, we've been talking about post-transplant. You had your son before the transplant, then you had another son afterwards.
Yes.
Tell us about that. That's exciting.
Yes, so 2 boys, 9.5 years apart. I've gone through many things with my health in that time frame, but I really look at it like, I wanted my life to be saved for my firstborn, but then I was able to bring forth new life in my secondborn, and be married, and we have a wonderful family together. And it's just, all those things are so beautiful because someone decided to be a donor, and so it's really special to me that I can even be here saying how grateful I am in that way.
I bet. Dr. Taylor, what are there any concerns about pregnancy post-transplant?
Not really. We have to just be mindful of the medication we give to prevent rejection can sometimes cause a few issues, and so it's good to get a good prenatal checkup and work with a high-risk OB team to make sure that pregnancy is not going to be an issue. But really, generally, we have a lot of moms who can get pregnant and have healthy babies afterwards.
I know. I remember you telling me about Amy. You were excited to tell me, hey, I have this patient, and she's been able to have a baby since her transplant, and that's always
very exciting.
Very exciting. Also, a big part of your story, as you had touched on, is that you had mentioned you had an ostomy during all this, and you still do, and it's going to be a lifelong part of your story. But now you're an ostomy educator, so educate us, if you will.
Yes.
What is an ostomy?
Yeah, so with ulcerative colitis, mine was the disease state was so severe, they took out my entire large intestine. So I'm left with an ostomy. It's called a stoma on the outside of your body. You wear this bag to collect stool and waste, but besides rerouting where it, comes out of your body, it's really that's really the only key difference. It's really the fact I get to still survive and live without that organ that was diseased. But to your point, God has just really brought it full circle in my life personally, because I am in the education field on that side. So I'm not in the classroom with children, but I am teaching patients once they go home from ostomy surgery how to care for themselves and really just give them hope and light that they'll have a good quality of life.
Oh, I bet they have lots of questions, and it's nice to hear those answers from you. No offense, docs, but just from somebody who actually has it.
Street credit is what she has.
Exactly, absolutely. And what is that like, just living with that and knowing that that's going to be with you? I bet it's just, again, being part of your story, but just so grateful to know that you're able to live a full, healthy life. And
full, healthy life. My 20s, for like a decade, I feel like were survival. So to be later 30s now, yes, I have an ostomy. Yes, I have lots of scars to show, but I really look at the mirror like, wow, look how much has happened. And I'm here. And I'm thriving. And, just when you're in the valleys, it's hard to know how to get out of that, but it's one day at a time. Great health care, great just people working with your body to try to get you to that spot, and I'm just very grateful I got to that opportunity.
And then you're also really active with Gift of Life, an organization that teaches about organ donation.
Yes.
Is that right?
Yeah.
So what message do you have and you want to share with donor families and others waiting for that call that you got?
Yes. Yeah, Gift of Life is also special to my heart. So I'm a transplant mentor, so I do get to speak to people on the list currently. I've had that opportunity to actually see them through to their surgery date, which has been rewarding. We speak in classrooms. We share education on what checking that box on your license, to be a donor really means for a high school student. But in general, to donor families, it's a hard decision. It's a hard decision for an individual to sign up to be a donor. The family has a lot to go through too when that process takes place. But it's a ripple effect. So if anything, that one choice can lead to multiple benefits, not just for one human being, but for multiple generations after.
Dr. Schmidt, what role does patient education play in helping people succeed after transplant?
I think it's a lot to do with kind of just changing your perspective on how things are, because people can live normal lives. It's just a big change. People struggle with change, and trying to educate them that, yeah, this is a giant hurdle to go through, but in the end you might be just like you were before, but just different, but you can still have normal life.
For sure, for sure. Dr. Taylor, post-transplant, Amy went on to have that other baby. We talked about that a little bit, but anything else that you have to monitor we kind of talked about it, but anything else that you have to consider medically for somebody after a transplant?
Sure. No, it's important for patients who get a transplant to get their vaccines, to keep their immune system strong. We monitor kidneys because some of the anti-rejection medicines can affect the kidneys, and just keep up with cancer monitoring, like skin care is very important. We do see a higher incidence of skin cancer in patients on immunosuppression, so we just kind of go through those routine things and make sure the liver tests are doing well. But the interesting thing is most patients' livers do great after transplant. It's just the side effects of the medications many times that we have to navigate.
And how close are we to new therapies that might delay or even replace a need for transplant with those?
There's some interesting, exciting areas, but it takes a long, long time for that to develop. I know they're looking at new medications for PSC, where, as Amy has mentioned, really right now there's no cure for the disease, and so there's been a lot of breakthroughs in new medications. So hopefully in the coming years we'll have actually medical therapy to offer, so not everyone has to end up thinking about a transplant if their disease worsens.
So is a transplant almost always necessary? Is that something you would tell somebody is almost inevitable, or?
That's the weird thing about PSC. We have some patients who have literally no symptoms, never have a problem with it the rest of their life after they're diagnosed. Then we have some people, the first time they're diagnosed, they get very sick, and that starts the ball rolling, and then everyone's in between. So it is a very variable disease with how it progresses within the individual.
All right, let's get to some questions from our viewers this morning. Jeremy wants to know, why is there such a strong connection between PSC and things like IBD and UC? Why is there such a strong connection?
It's very interesting. So all the blood from your colon actually first goes through the liver. Your liver is your major organ for nutrition, and so it takes all the nutrients from your intestines that get absorbed, and then those get processed by the liver. So if the colon is inflamed, you're getting a lot of the bacteria and toxins that come across, and they end up in the liver first place. And that can then start an inflammatory response and then end up damaging the bile ducts. And that's where the disease originates.
Marcia is asking, how does she help people live with the change? On social media, there are people sharing their ostomies, wearing bathing suits, working to help people normalize this life-saving change. What do you think is the most important thing that you have helped educate people about?
Yeah, no, it's a great question because there's that fear of like, well, now can I still have a good quality of life? Can I do anything I want to do previously? In my role, it's really, really rewarding at the end of the day to have these conversations, encouraging them. You can absolutely still do what you've wanted to do in life. In 15 years of having an ostomy, I've done, you name it, I've probably tried it. And so it's really cool because I can be active, I can be social, the fear is gone. And honestly, I'm living way healthier with an ostomy than I did with the ulcerative colitis disease. So just hope. Hope is really key.
Tanner is asking Dr. Schmidt, after seeing hundreds of patients receive transplants, what kind of moments stay with you the most?
I think these kind of moments, I mean, we certainly have our experiences in the OR where we feel like patients almost don't make it, and then we get to the other side where people come back years later and they're having normal lives. So it's all that angst and loss of sleep and whatever is all worth it in the end, because most people do turn out to have great lives.
That's great. That's great. Ellie wants to know, how did you explain your transplant to your kids? I loved how you mentioned, you said line leader when talking about being next in line for a transplant. Any other things that you explained to your kids?
You know, we believe in God and we're a faith-filled family, and so I think I've always just attributed it to, you know, Mom has some scars and this is the road that I've traveled, but I've always remained optimistic, and when I share that with my children, it's in the same way. So just gratefulness, I think, shines through when I talk to my children about my story, whether it be the ostomy or the scars. It's just like, Mommy looks different, Mommy has this, but let's go play, you know, like let's live life.
Love that. Brody has a question for Dr. Taylor. What's the most common question you get from patients who are told that they might need a liver transplant?
They just want to know what to expect because there's so much uncertainty, as Amy said. You know, there's a waiting list involved. You have to get through testing. There's this, you know, fear that a transplant may not go well, and so just trying to help dispel some of those fears and help them just feel comfortable and understand we're going to work as a team and get through this process, I think, can be very reassuring for patients.
Amy Ansley wants to know, what is the first thing you remember wanting to do once you started feeling a little bit better after your transplant?
Yes, you know, you get used to a new normal of just feeling sick every day. So that was just what I was used to. And I was really, really pleasantly surprised and shocked how quickly my body came back to good health. So once I got home, my son's 4, I just wanted to go on a walk with him to the park. And we did. There was a park a half a mile down, and I was supposed to be in recovery and start walking a little bit. So I used the opportunity for not only my body to recover, but to be with him. And you know, he just thought Mom was back and Mom could play. I could do a piggyback ride again. I could hold him again. I wasn't so tired and fatigued to just take a nap. So that was, at that time, that was my first goal, is just be a mom.
Just those things we take for granted.
Yes.
Oh, that's so nice to hear. Dr. Schmidt, you always say how when you do a kidney transplant, people feel really good, really quick. Yes. Is it the same go for liver?
I think PSC is similar to kidney disease because it's really insidious and long-lasting and more chronic than some of the liver diseases. So they tend to feel different, better energy, and they don't have that lingering chronic infection going on in their bodies.
So nice to hear. What's the biggest takeaway from our conversation today? What do you want people to know?
Just donor awareness. You know, the holidays are coming. Just make people aware that they can give. Even living donors now, you can donate a kidney or even half of a liver to somebody. You might know somebody who's on the list. You just have to really explore and be open to giving. Yeah,
that's a great point. Yes, talk about it around the table this holiday. Yes. Dr. Taylor, what's the big takeaway today? I think this is really a story of faith. I think, you know, these patients have these very difficult situations. They put their trust in their medical team and their families and everyone around them to get through this very difficult process. But I think really having strong faith as a patient really can help get you through these difficult times. Amy, what's the big takeaway from your story? Yeah, to piggyback off that, I think your mindset is huge when you're waiting. It's daunting, it can be challenging. You physically don't feel well, but you're dealing emotionally, mentally, you know, everything combined. But one day at a time,
have a great support system, a great medical team. I'm grateful to Dr. Schmidt for performing my transplant, to Dr. Taylor for getting me to that point, and even now with my aftercare. So donor families, thank you for your sacrifice. It's not in vain. It saves so many lives, not just mine.
Well said. Thank you all so much. Thanks to all of our guests, all of our viewers for being with us today. Have a great day, and we'll see you back here tomorrow.
Can listening to live music change your brain? I'm Alexis Del Cid on the next All Things Brain Health, the science behind using music to treat hearing conditions.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.